Life and death. Wyandotte County now viewed by some as one of the sickest in the state.
Some people even having to wait longer to see a doctor than it takes to legally get a gun in Kansas. Jenna Hanchard shows us this impact it's having on families. Jenna.
Yeah, Mike, Krista, the study took into account how long people live and their quality of life. Out of 101 counties, Wyandotte County ranked 94th. Meanwhile, its neighbor Johnson County ranked 2nd.
This is a daytime or diabetic medicine.
46-year-old Tracy Davis suffers from diabetes, high blood pressure, and arthritis.
Just last week, I was sick for a couple of days to where I was just too tired to get out of bed. My sugar was over 300. And at that point, I'm just exhausted.
Exhaustion is normal for this Wyandotte County mother who lost her health insurance last year after she was laid off at Sprint. Without health insurance, her medicine would cost about $700 a month. So she's forced to take medicine from family members.
So my grandmother's diabetic and my stepfather's diabetic. And they tend to try to share their insulin with me to help me when my sugar is really high and I can't get it from anywhere else. So that takes away their quality of life because they're sharing their medication with me.
For anyone who does not have reliable coverage to health care, this is the unfortunate outcome.
The organization Communities Creating Opportunity is working to improve the health outcomes for people like Tracy. Through their research, they've identified hotspots or zip codes where there are high concentrations of chronically ill people who are underserved. In Kansas, that's Wyandotte County.
The result of all this means that these individuals live shorter and sicker lives, right? And so, I mean, I could say it a lot of different ways, but this is critically important because this really kind of robs individuals of their true potential.
In these economically depressed areas, many people are without health insurance. And like Tracy, they rely on emergency rooms and safety net clinics like this one.
I felt like I was turned away at every clinic, and I had never used the clinics before.
For Tracy, wait times for appointments were about 3 weeks, forcing her health issues to compound.
I don't know how much longer that it can last like this without the insulin. And just not having the insulin, I don't have life insurance.
Local leaders now want the community to try to tackle these issues.
I want to see my grandkids graduate. I want to see them get married. With the way that I'm going now, it's not guaranteed that I will be able to do that.
This afternoon, I spoke with the director of 2 safety net clinics in Wyandotte County. She says the need is great. Between 2008 and 2013, they saw a 71% increase in patients. She says they're paddling as fast as they can with the resources that they have. Jenna Hanchard, 41 Action News.
Jenna, thanks. Tomorrow, community